The Friends and Family Test is a simple question that's asked to patients when they leave our hospital, so whether that's when they leave outpatient department or whether they leave after an inpatient stay, and it asks them how likely they would be to recommend our hospital and the services we provide to their friends or families. It's an important baseline of how satisfied patients are with the service they've received, based on what they expect from us as well. But the biggest opportunity is that we have time to get other information that's more meaningful from our patients at the same time, so we can get some real qualitative stuff that we can then do something about for our patients to improve their experience of our services.
We have a postcard, the free post address on for patients who might want to take time to consider their response. So the same question is asked and they are able to rate their experience. There's also a comment box so they can explain to us if they have had a bad experience why, and that's incredibly useful for them to respond to. But we also have the token box because that often we're finding that more patients are using that method because it's quick and they don't need to stay and fill a form in or do that later. So our response rate has really improved since we've had the token box. We have another option also for patients or relatives that come in and have smartphones. We have a QR system where they can scan in and then they can follow up with their response and feedback perhaps at a later time when they're at home and can make a more considered opinion. So that's quite a useful alternative.
I think before we had a volunteer coming round and asking patients what they felt about their experience, but now a proper survey's being done and the results are fed back to us so they can be addressed, and it's open for all the ward to see. It's completely transparent. To have 70-80 people say the care I received was fantastic, this was like being in a 5-star hotel, massively increases morale. Some days are tough, this is a heart ward as you'd expect, not all days are great, so to be able to say 10 out of 10, the staff are amazing. Staff very efficient and kind, and food has been good, first class service, everything is absolutely fantastic. It's great.
Well, initially I think the wards were quite concerned because they had to display their results outside their ward, and sometimes if for whatever reason there weren't many patients feeding back, their score could be quite poor or appear to be quite poor, and that was quite worrying for ward sisters because they're very proud of their wards and what the care that they deliver.
Initially as a department we wondered whether the right question was being asked, but actually we've realised that it's a very important question and we want to make sure that we are providing absolutely the best service and the best patient care.
I think the fact that it's nationally adopted means that we're all measuring the same thing. For us it's really useful because we measure ward by ward and we compare ourselves internally as well as externally with our neighbouring hospitals and services. Food was one of the things that patients commented on that could be improved more often than not. And as a consequence of the feedback that we receive from our patients, we've introduced a fruit trolley which comes around to every patient every morning and provides a good selection of fruits that are available to patients for whatever diet that they might be having.
Having the fruit trolley come on the ward reinforces the positive message of healthy life and health promotion, and it looks so good, it's very appetising to patients, and it's well received.
I mean, everything's not perfect in life, but just be happy that you're here and people are giving the time and their expertise to sort you out. That's how I feel,
To improve any kind of service in this country, if your customers are not being listened to, how do you know whether you're getting it right or wrong? So it's important that your customers get to voice that.